Last year, the hospital had 80,000 cases of delivery babies. They already have 20 ultrasound rooms, and maybe in next future year they'll be extending to 40 rooms. We have Photon CT also. 2 years they are aiming to have 1,000 bedded hospital.
This
Phan Hospital, which we were actually showing you around, and this is the hospital where our Indian students are going to get trained.
One building here,
and they're coming up with a new building. This hospital is already a 400 bedded hospital, and now the students, I mean, they're constructing another 600 bedded hospital there. So together it will be a 1,000 bedded hospital. They're coming up with a new building, and that building is going to be specially for oncology department. It's mainly for oncology and radiology department, so that they're going to have one of the best international cancer institute, a cancer medical center.
And we have all different things.
So this hospital is also collaborated with Dai Nam University of Medicine and Pharmacy. So let's see the hospital. I feel like the hospital has a state-of-the-art infrastructure with all the highly equipped diagnostic centers and everything. So let's just start with the conference. We have all the departments. When I saw the video, I understood that we have a OBG, we have a, or you are good in the cancer thing, right? Yeah. That's great. Yeah. So when the students are going to come here for the training program, maybe the classes for the students will also happen here, right? When the professors, your doctors will teach them. And then take them around to for the clinical training programs. Much for giving us an opportunity to come here. We'll be very happy to send our Indian students to Phan Hospital, and we are having more than 600 students studying in Vietnam, in Can Tho, as she mentioned, in Can Tho and Da Nang and Ho Chi Minh. Now this is the first time we are bringing our students to Hanoi, the north of Vietnam, and to Dai Nam University of Medicine and Pharmacy. So we'll be very happy to, this hospital is really very good, and it has a state-of-the-art infrastructure and facilities, and this will be very useful for our Indian students to practice and to learn medicine. Thank you so much. So this hospital is established in 2019. This has at least 400 bedded hospital, and they're looking out for, they will be having another 200 bedded by end of this year. So totally we are in the hospital which has 600 bedded, and by next 2 years they are aiming to have 1,000 bedded hospital. So along with this, we are having one of the state-of-the-art infrastructure. We are constructing a separate building just for oncology department, and the hospital, the outpatients per day is minimum 600 to 700 outpatients, and the inpatients are at least 300. So really this is one of the biggest and the very good hospital in Hanoi, and we are in this hospital, and our Indian students are going to get trained in this hospital. Yeah, let's go see the infrastructure. So this is a restaurant and a canteen for the patients and the doctors.
So basically in every single bed, in every single patient, inpatient especially, if they want to come to they stay in the hospitals, they have to have some meal, right?
Yeah.
If you have meal, they need to follow with the nutrients schedule.
Okay.
Yeah, the regimen. So this one, all the chefs, they do the same thing as well.
Okay,
yeah.
Okay.
So they will be served all the food in bed.
Okay.
But beside the bed, you can have a restaurant for the outpatient.
Okay, fine.
Yeah.
I got it. So this is the place where the patients get the food from,
yeah.
And it will be high rich in nutrients.
Yeah.
So the dietitians, nutritionists will actually select
the
regarding based on the patient's health condition.
Yeah. at the day 4.
Uh-huh.
So all the clinical structure is all similar.
Okay.
So that's why we just have some brief introduction about 2 or 3 departments.
That's enough, yeah.
Yeah, that's enough.
So,
That's enough.
internal medicine department, and this is the inpatient thing.
So this one
We
is
have
like
some-
Ví dụ đây là một bộ bệnh điển hình.
So this is the inpatient,
Là cái phòng hành chính.
and this hospital has minimum 300 to 350 inpatients every day. Hello, ma'am.
yeah. So this one is the administrative office for the internal medicine department.
Hello.
Yeah.
So we are here to bring our, we have partnered with Dai Nam University of Medicine and Pharmacy, and we will have our students to come here for clinical training. So take care of us. This is the intensive care unit, the ICU. So we'll just take you around. I don't want to disturb the patients much. You just want to see the facilities of the intensive care unit. So I think so the nurse station is right here, and we can see the patients here. So this is the Department of Internal Medicine. So this floor, the patients, you have the regular rooms, you have an intensive care unit, you have a nurse station here. So I think so this hospital is huge and really big. And as I already mentioned, the inpatient is minimum 300 to 350 per day, and the outpatient is minimum 600 to 700 patients per day. And this hospital is a 400 bedded hospital, and they are going to have 600 more bedded by March. So by the end of this year, this hospital will become a 1,000 bedded hospital. That's huge. So it's a 1,000 bedded hospital, and that is where our medical students are going to get trained, who are coming from India to study in Dai Nam University of Medicine and Pharmacy. So this is an OBG department. Last year, the hospital had 80,000 cases of delivery babies, and this year it's going to go beyond that. And today the inpatient in OBG department is 105. We don't see this kind of a hospital anywhere. And I am so proud and happy to be associated with Dai Nam University of Medicine and Pharmacy when our students are going to get trained in such a huge hospital with a high infrastructure and state-of-the-art facilities. Thank you so much. So this is the gynecology department, and the whole floor, the complete floor is for gynecology. There are more than 100 patients who are already in this department. We just saw a newborn baby, just born, and so cute. So these are the neonatal sessions where the babies are kept after the delivery before they take them to the mother. So this is the delivery rooms. So the labor wards especially. We have 3 labor rooms. So this is one of the labor room for the normal delivery. And if there's going to be a C-section, then they'll be taken to the operation theatre, and after that the patients will be brought back here.
Okay. So the thing is, we're now with the we can call this quite easily with the surgery systems.
Okay.
So the surgery system, we have like 12 surgical room right now in operation in the hospitals, and we plan to extend that to 25, like we plus until like total with 25 surgical rooms now.
Okay.
In a total.
So this is an international standard surgical center where you have an anesthesiology and intensive care department also in the same floor. So they have already 12 operation theatres, and in next 3 to 4 months they are coming up with 25 operation theatres. So that is the number of surgeries. And can we know how many surgeries happen here per day in every department?
5 cases for a day.
Oh my God, per day they will be having at least 45 cases. Every day they have minimum of 45 cases per day. So that is a lot, and this is the kind of infrastructure we are talking about, and this is the amount of patients this hospital can take care. So that's huge. That's really huge. Yeah.
test.
This is the laboratory
Yeah.
where the blood test or any other
Yeah,
test
biochemicals,
or
immunes,
biochemistry,
yeah,
microbiology,
all
and
of that.
pathology department.
Yeah.
Yes.
all
yes.
of-
Thing.
Yeah.
So they have the AI technology incorporated from the Korean company for the endoscopy. So if by chance, doctors, if they overlook a situation in the patient's stomach, so then the AI will actually find it out. So this is the high-tech hospital, and they use the best technology, anything to be introduced, right?
Yeah.
Yeah. This is IVF training, yeah. This is more of IVF department,
Bên nọ có biết là
which
có
is
thể
connected to
mình có
OBG.
muốn xem bên khoa nhi một chút ạ. On the board is like the Phan High-Tech Fertility and Radiology Center.
Okay,
And this one, you also have some kind of like the IVF center as well in this floor.
okay.
But it's really bad that you guys cannot come to see directly with the.
I know. But this is very important, the need of the heart today. So this is the IVF center with the high-tech technology.
Bệnh nhân thì chắc là
So
vào
this is
vào
the
cái phòng
outpatient
khám
department.
ngoại thì nhưng mà bây giờ tầm này cũng
And
là
as
cuối
I
giờ rồi
already
thì
mentioned, the
cũng không
number of
vắng nữa.
outpatients will be minimum 600 to 700 per day, and that's how this hospital can take, and they can take more than that. This hospital is going to be a 1,000-bedded hospital very soon, and our students from India are going to get trained in this hospital. That's the best thing I can see, and I'm very glad to be associated with Dai Nam University of Medicine and Pharmacy to give an opportunity for our Indian students to get trained in such a very high technology medical hospital. This is the EEG room.
If you look on the left, on the right, you can see we have like the insurance counter and
Insurance
counter.
counters, okay.
That on the right one is the pharmacy. When you want to get the medication, you get from pharmacy. We have two different pharmacy.
Okay.
One for the health insurance services and one for non-health insurance services.
Okay.
Even though we're private, we still have some kind of like services for the health insurance.
Okay.
Just in case that the patient they have.
Okay.
Yeah.
Okay, so they have both health insurance and non-health insurance services.
From pharmacies.
From the
Yeah.
pharmacy, there's a reception, and this will be the insurance, and that is the pharmacy. So.
So with the MRI, we have like 125 Tesla.
125 Tesla?
Yeah.
Okay.
And
How many slides?
As a CT scan, how many?
Space CT, PET CT, Photon CT.
we have like SPECT CT, TAS CT, Photon CT, yeah, all of
You
that.
have Photon CT also.
Mấy ngày rồi chỉ chờ vài nhà xong rồi.
So all the machines already arrived. We just wait the building to be complete so we can just transfer the machine into the building.
Okay, so the Photon CT is especially for oncology department,
Yeah,
right?
oncology department.
So they have the Photon CT, the regular CT. So what is the number of slices you have in CT machine?
Bao nhiêu dãy bác nhỉ? 128 đúng
Hiện tại là 128.
không? 128.
Còn kia là 520. Máy mới là 520.
The new one will be like 520 slices.
Okay, the new one is 520 slices for the oncology department, and regular slices is 128 slices CT machine. So those are the best machines usually any good hospital, any high-tech hospital used to have. Yeah. Control room of a CT department. So these are the system where they can analyze, understand the radiology, understand the scanning report of this patient, and that's the CT scanning mission.
Yeah. And one more thing is in the control room, we have like different languages for different patients.
Okay.
We have like on the settings. So in case that you are Russians, you like Chinese, you Korean, you have like different languages options. So when the patient they come to the room, they hear the command in their own language.
In their own language. Oh,
Don't have to be English.
Okay, so
Yeah.
that's good. That's
Yeah.
really good.
Yeah.
So this is the MRI scan machine. Sorry, this is the MRI scan machine. So this is the control room where they can update the scanning reports of the patient, and that's the MRI scan, and it's happening. There's a patient. And so these are the X-ray rooms. They have X-ray room 1, 2, 3. So these are the places they have very well secured X-ray rooms.
I just want to mention that.
Và có lúc nếu mà bệnh nhân đông thì phải nghe thì cái không.
Okay. So right now it's like 20 rooms.
20 rooms for ultrasound.
Yeah, but in case that we need to have like extended the room for like because of a lot of patients, we can extend like 40.
They already have 20 ultrasound rooms, and maybe in next future year they'll be extending to 40 rooms by end of this year.
No, 40 room in case that
In case if
there are
they
so many
want-
patients come.
Yeah.
We need to extend that
Yes.
to meet with the requirement of the patient
Yes,
come.
so now they have 20 ultrasound rooms, 4 X-ray rooms, 4 CT scanning, and 2 MRI rooms, right? Yeah, so this is the
MRI là mình
amount
có một
of
phòng thôi đúng không?
infrastructure they have.
Và một CT đúng không?
And one CT, they have 20 ultrasound rooms, and they have 4 X-ray rooms in the radiology department.
Okay.
Very nice. This is the high class executive rooms for the patients. So